Hi, I'm Dr. Noah Edvelson with ChiroHub.com. We're bringing you another exciting product review today. We're going to talk about another PEMF system, and if you've been following some of our videos, you know that this is a hot topic for us. Why? Because mainly none of us have been exposed to this in chiropractic college, and we're baffled as to why. This is something that's awesome for pain, it's safe, it's effective. We're treating pain all the time. We should have the tools to be able to treat this effectively. And in chiropractic college, we get exposed to things like ultrasound, electrical muscle stimulation, traction, maybe some decompression. If you're lucky, you got cold laser, but nobody is talking about PEMF. It's been around for decades, it's safe, it's used all throughout the world by many different professions, and we think chiropractors should be one of the groups leading the pack on this. This, I believe, is one of the treatments that we're going to see more and more often out there in the field. It's getting a lot of attention now. You're seeing it used by professional athletes, and we really like this PEMF. So we've done some research and tried to find which systems are the best. This system, we're working with Dr. Pollock, and he has helped us to put together this demonstration so that we can help educate you about some of the other possible therapies out there to treat your chronic and acute pain patients. So this is the PEMF 120. It's one of the larger PEMF devices. PEMF tends to be categorized into about 2 or 3 different categories based on how powerful the treatment is and how powerful or strong the muscle contraction can be with the associated machine. This is in the category of the high intensity machines, meaning you'll actually see a physical muscle contraction. We're going to show that to you later in this video, and it's quite impressive. You'll see the patient's shoulder jerk around because it's such a strong contraction, and the coolest thing is that it's quite comfortable for the patient. So it's very therapeutic. You can also use PEMF to treat a wide variety of other conditions. We'll talk about some of those, but it's things like non-union fractures, pain. They're using it for mental disorders, neuropathy, all kinds of interesting things. And many of you are seeing these things in your office, and this is just another very effective tool that's safe, and patients really like it. It can help set you apart from the competition. So we highly encourage you to look further into this system. We're going to show you a demonstration. We'll talk about the pros and cons today, and we really hope that you'll dig up some more information on this, do your research, and seriously consider getting one of these for your clinic. Okay, are you ready to see the PEMF 120 in action? We know you don't get to see things like this in chiropractic college, so we're really excited for you to see how this really works with a patient. You're going to notice a very strong muscle contraction with the patient, much stronger than you're able to achieve with electrical muscle stimulation, and the patient will still be quite comfortable. You'll still see she's smiling throughout the treatment and able to tolerate a fairly intense contraction. So we're going to go ahead and start this up. We'll hit the power button here first. You'll hear a cooling fan turn on. And then we always want to make sure the intensity level is turned down. So we turn it all the way down just until it's snug. You don't have to torque it too hard. Then you set your timer. This is somewhat of a primitive timer. It's not going to count down during the treatment. So once you choose your setting, the timer will just automatically end when the treatment is over, but you will not be able to see how far along you are in the treatment. So we'll go ahead and turn this up to 10 minutes. We've got the intensity down, so we'll hit the start button. The green light will appear. And then we choose what area we're treating. We're going to just show you some of the shoulder today with this butterfly coil. This is one of our favorite coils because it's so versatile. You can have a closed loop system like this, and you can move it around. You can open it up like a butterfly like this. If you do that, keep in mind that it will decrease the intensity of the treatment. You can wrap it around like that. You can also do it like a sleeve, up like this, for some of your smaller joints or upper and lower extremities. So let's start with the posterior rotator cuff and take a look here. As I turn this up, you'll notice the frequency of the intensity and discharge changes. So she doesn't hardly feel anything now, and you can hear the little tick, tick, tick. They're quite close together. As we turn it up, they'll become further apart, and they're going to get stronger. See, she's still smiling. We're up now at about 30 to 40% power, and you'll see her entire arm is moving. It's a pretty strong contraction. If you put your hand on there, you can actually palpate the contraction in the muscles. The other cool thing about this is that it will zero in on someone's injury. So if they have a sprain, strain injury, and they have palpatory tenderness in a specific spot, the PEMF will locate that, and that's where they'll feel it the strongest. We can go up a little bit higher just so you can see. Still pretty comfortable, isn't it?
Yeah.
Her entire arm is moving because of the strength of the contraction. It's a really deep feeling, and patients will really appreciate it. They'll know that you're doing something, that you're having some kind of a therapeutic effect, and they appreciate that. Whenever we go to move areas, we always turn the intensity down a little bit so it doesn't surprise the patient. But if we wanted to bring this around here and treat the front, we could do that. You can actually treat the head, pretty much anywhere in the body, as long as there are no contraindications with electrical implanted devices. If you want to stop the treatment, you just turn the intensity all the way down, or alternatively, you can just take the timer and turn it down to 0. And that will turn the green light off, and you're finished with your treatment. There are many reasons why PEMF is becoming increasingly popular in a clinical setting. We want to focus on the areas that are most pertinent for chiropractic patients. Anytime we're trying to heal someone, we need to increase their ATP production, their circulation, and speed that healing time, whether that's a bone fracture, a myofascial trigger point, joint dysfunction, sprain, strain, or other chronic injury. The wonderful thing about PEMF is you can do this in a way that's non-toxic, no drugs involved, no surgery, and it's painless to the patient. As long as you keep the intensity at a comfortable level, you can treat deep tissue and have a drastic effect on clinical outcomes. When benefiting patients is your primary objective, your clinic will be more successful. One of the great things about PEMF is that you'll have better patient outcomes. Word travels quickly, and people are going to be asking about this treatment, especially as it becomes more popular in the mass media, as it's already been featured in places like Dr. Oz. This will also help set you apart from your competition. You need something unique to set you apart from everyone else in the valley. How many practitioners do you know that have a high-intensity PEMF device in their clinic? You'll be alone, and you'll be getting better patient outcomes along the way. The other great thing is that unlike some technique systems that require months or years to learn and become proficient at, you can literally learn how to use this PEMF device in less than an hour, and you can train your staff very quickly. It's easy to use, and it has good quality patient results. This translates to increased revenue for your practice, so you can help more people and enjoy more time with your family. The other nice thing is that this will open up the window to new patient populations with chronic patients that aren't getting results in other places. You'll be someone they can come to for an answer to difficult cases when chiropractic adjustments or rehab are not working. Okay, for all you techie nerds out there, I'm sure you want to know the specs of the PEMF 120. How powerful is this beast? Well, this particular device can reach a maximum intensity of 2 Tesla, which is 20,000 Gauss. So if you're familiar with any PEMF devices, you know that this is a very intense system, and that's why you're going to see the strong muscle contraction. It's also going to translate into faster patient results and happier patients and more referrals to your practice. Okay, so you're probably wondering, is there even a downside to this PEMF 120? It sounds fantastic. Well, there are just a couple of things that you may have concern about. Number one is that the display, as you'll see on front, including the timer and the intensity knob, are a little bit outdated. They could use an update for the technology that we have nowadays, and we'd also like to advise you that there's a little bit of a sticker shock for some people. This device comes in around $20,000 depending on your particular options and package that you choose. But we wanted to calculate a return on investment for you really quickly to show you that with just 10 treatments a week, you can easily break even at the 1 year mark. So anything beyond that becomes a bonus to your clinic. Having now used this PEMF device in our clinic for several months, we can assure you that it's well worth the price. And therefore, without hesitation, we give the PEMF 120 the prestigious ChiroHub seal of approval. This is a wonderful machine. It literally changes patients' lives. It's painless, it's easy for you to incorporate into your practice, minimal training, and it's effective. We really hope that you'll dig up more information, do your research, and really look into incorporating this wonderful therapy into your clinic. For more information, you can check out Dr. Pollack's website. He has a load of information on there. He's a wealth of information and knowledge about PEMF, and we highly recommend that you look into this further and incorporate it into your treatments for all of your patients.